So this is basically hepatic encephalopathy. You must be very clear about that. Look at the video, what it is showing. It is typically showing the flapping tremors. So this is also called as asterixis. Asterixis by default is not specific for hepatic encephalopathy. It can occur in other conditions like even hypercarbia due to CO2 narcosis in patients with acute exacerbation of COPD, or probably in patients with other cause of metabolic encephalopathy as well. So it's not really specific, but in exam, many times when you say asterixis and flapping tremor, you're going to think in terms of hepatic encephalopathy, that too in a patient who is cirrhotic and presenting with altered sleep-wake cycles. And Doppler ultrasound shows hepatofugal flow that is like kind of, yes, it's going to happen in patients with portal hypertension. And what's going to be the treatment here? The first line treatment for hepatic encephalopathy, is going to be lactulose and rifaximin. That's the first line treatment. So in fact, lactulose is going to be the first line treatment. Rifaximin can be added in severe cases or refractory cases, but generally we do add both in practice. So what about TIPS placement? It can be tried in patients who are having uncontrolled portal hypertension complications and not hepatic encephalopathy. In fact, presence of hepatic encephalopathy is a contraindication for TIPS placement. You cannot place TIPS in the presence of moderate to severe hepatic encephalopathy because TIPS itself can result in hepatic encephalopathy. In fact, one of the most common complications of TIPS is hepatic encephalopathy. Paracentesis here, ascites is not the issue. So IV mannitol again is not going to work much, even though intracranial pressure is raised in patients with hepatic encephalopathy. This is not the frontline treatment. It's going to be lactulose and rifaximin.